Dear Madam or Sir, welcome to this poster presentation entitled Analgesic and Anti-Inflammatory Effects of ACD137, a potent and selective negative allosteric modulator of TrkA. My name is Pontus Forsell, and I'm one of the co-founders of AlzeCure Pharma and head of discovery and research at the company. The poster was presented by Dr. Märta Segerdahl, our Chief Medical Officer and also a specialist doctor within anesthesiology at the 9th International Congress on Neuropathic Pain in Berlin in September 2025. Before I go into the results, I will give you a short background of the target pathway, namely the NGF-TrkA pathway. NGF is released upon an injury either in the skin or inside the body, for example in the knee joint. So upon release from surrounding cells, NGF can bind to the receptor TrkA or TrkA, which is situated on both neuronal as well as non-neuronal inflammatory or immune competent cells. Binding of NGF to TrkA will initiate a pain signaling that is mediated through the dorsal root ganglia up to the pain sensing areas in the brain. Alternatively, binding of NGF to TrkA on immune cells will elicit an inflammatory response. Thus, NGF and TrkA are both involved in inflammation as well as in pain sensing pathways. The NGF-TrkA has been clinically validated by the use of anti-NGF monoclonal antibodies in many different clinical studies, including large phase 3 clinical studies in patients with osteoarthritis. The figure here demonstrates the effects of tanezumab, an anti-NGF antibody, in patients with osteoarthritis. And as one can see, increasing doses of tanezumab leads to increased pain relief. Additionally, the target NGF or TrkA has also been genetically validated in humans where disruption or point mutations in the gene for NGF or TrkA leads to a loss of pain sensation. Thus, the NGF-TrkA pathway is very well validated within pain signaling. So our hypothesis is that selectively targeting the TrkA receptor will be a safer way of reducing pain than using anti-NGF and monoclonal antibodies. So the mechanism of action behind anti-NGF and monoclonal antibodies is that they sequester both NGF as well as pro-NGF from the circulation, thereby leading to a reduction of the signaling through TrkA, but also to a reduction of the signaling through P75. Importantly, P75 has been demonstrated to be involved in bone homeostasis as well as in homeostasis of arthritic knee joints. Thus, inhibiting this pathway, the P75 pathway, might lead to an effect of the bone density or bone mineralization, as can be seen in the figure here, where P75 has been knocked out in animals. That has been done either systemically or conditional knockout, and several papers now describe that P75 do indeed play a role in bone density, as can be seen in this figure, where P75 knockout animals demonstrate less bone density than wild-type animals. So definitely there are now convincing evidence that the P75 receptor is involved in regulating bone homeostasis. Additionally, TrkA inhibitors, those are non-selective inhibitors inhibiting both TrkA, TrkB, and TrkC, are now in clinical use within oncology, and those molecules like larotrectinib or entrectinib have not demonstrated the same side effects such as rapidly progressing OA that was observed for the anti-NGF antibodies, suggesting once again that the inhibiting the P75 pathway could lead to the observed side effects of the anti-NGF antibodies. So our hypothesis is that by selectively targeting the TrkA signaling by a negative allosteric modulator, we will be devoid of some of the side effects seen both for TrkA inhibitors, such as CNS-related side effects, or the rapidly progressing OA seen with anti-NGF antibodies. There is one other company working with a TrkA-NAM molecule, AlzeCure. They have their molecule AK1830 currently in phase 2b clinical trials in patients with OA. So the aim of this study was to evaluate ACD137, which is a potent and selective TrkA-NAM molecule, for its effect in neuropathic pain and in model of osteoarthritis. So this first slide shows the results from a neuropathic pain model, namely the chemotherapy-induced peripheral neuropathy model, where animals do develop peripheral neuropathy after injection of paclitaxel for 10 days. So on day 13, the animals are tested for mechanical allodynia, as we can see in this slide, comparing to naive animals. The animals administered paclitaxel do have increased pain sensitivity. Administering either gabapentin at 100 mg per kg or ACD137 at decreasing doses will lead to pain relief in these animals, suggesting that TrkA-NAM molecules or ACD137 are efficacious in treating pain in models of chemotherapy-induced peripheral neuropathy. The other model, monoiodoacetate-induced arthritis or MIA-induced arthritis, is a model of arthritis commonly used in rats. So here, osteoarthritis is induced by intra-articular injection of MIA, and after 3 days, there is an established inflammatory process going on, and the animals develop pain sensitivity both to heat and mechanical stimuli. So the figure to the left here demonstrates non-evoked pain sensation by the animals. So that's measured between as a weight distribution of how much weight the animal puts on the hind limb. And as you can see, animals administered MIA do have a change in the percent of weight distribution, so they put less weight on the leg that have the osteoarthritis knee joints. Whereas naive animals, they distribute the weight more evenly between the two different hind limbs. As you can see, treatment with ACD137 at 3, 10, or 30 milligrams per kilo do induce significant pain relief, which actually is within similar efficacy as tanezumab at 0.1 mg per kg. So already at the lowest dose of ACD137, when given twice daily by oral administration, this low dose gives the same pain relief as an anti-NGF antibody. Also looking at the inflammation, as you can see to the right here, inflammation was measured by the diameter of the injected knee joint. And as you can see, there is a clear increase of the knee diameter in vehicle-treated MIA-induced animals compared to naive animals. This inflammation can be reduced in a dose-dependent manner by ACD137, thus demonstrating that there is, apart from a pain-relieving effect, there is also an anti-inflammatory effect of ACD137. Last but not least, we've also looked at the knee joint pathology. As can be seen on this slide, animals treated with MIA do develop knee joint deterioration, as measured by the Mankin scoring system. Administering ACD137 at 310 or 30 mg per kg do demonstrate less histopathology, thus suggesting that there is less damage to the knee joint after treatment with ACD137. This was actually not observed for the anti-NGF antibody tanezumab, suggesting that ACD137 or TrkA-NAM molecules might have additional effects that are not observed with tanezumab. Might be related through signaling of P75, but that is still to be determined. So in conclusion, the NGF TrkA pathway is a well-validated pathway for new analgesics, might be without the side effects that are observed for anti-NGF antibodies, but definitely without the side effects or dependency issues observed for the opioids. Identification of selective TrkA-NAM molecules is a novel way for selectively inhibiting TrkA while retaining the analgesic efficacy. The effects of ACD137 described in this poster do demonstrate that there is an effect both on neuropathic pain models as well as in osteoarthritis-like pain model. Interestingly, the analgesic effect of ACD137 was similar to the effect of the anti-NGF antibody tanezumab, but ACD137 differentiated from tanezumab by showing these joint protective effects. So in conclusion, ACD137 is a molecule that is well suited for further preclinical development. And with that, I thank you for your attention. And if you have further questions or would like to have further information, please contact Martin Jönsson, our CEO, at martin.jönsson@AlzeCurePharma.com. Thank you for your interest in this poster presentation.